We have with us this evening Ms. Devika Ruplal, who is the Analytical Services Division Manager at Kaizen Environmental Services Trinidad Limited, and holds overall responsibility for development, management, and operational efficiency of all activities in the laboratory, including field sampling services, wet chemistry, trace metals, organics, objectives, analytical procedures, quality assurance requirements, problem resolution, and general project implementation. She holds a master's in engineering, in process engineering, a project management professional certification. She's a Lean Six Sigma yellow belt and a diploma in petroleum engineering. She holds also a level 2 wastewater treatment operator certification from the Association of Boards of Certification, ABC of the USA, and has also completed the ITEC sewage treatment processes in India. Of course, she's well decorated with qualifications and has had other training and over 5 years of experience in water and wastewater treatment industry. So I'm going to hand you over to our presenter this afternoon, Ms. Devika Ruplal, and we'll tell you what she's going to present. Over to you, Devika. Where is she? No, I think she's muted. Oh, conferences are okay. Just now, let me see who is conference. Just let me try to unmute her. Just let me. Are you on, Devika?
Yes, can you hear me now? No?
Yes, I can hear you. Yes, proceed.
Hi, good afternoon. So Vika, and greetings from Trinidad and Tobago and Kaizen Lab. Just some context into our discussion. So the discussion really is disinfection in water and wastewater treatment, and especially now the fight against COVID-19. On January 30th, 2020 was where the World Health Organization declared COVID-19 outbreak of global health crisis. And then in less than 1.5 months, on March 11th, 2020, COVID-19 was declared a pandemic. So really that's the context for our discussion. If we were to just recap what disinfection is, so disinfection is the process whereby a significant percentage of your pathogenic organisms or microorganisms are killed or controlled. The disinfection of potable water or wastewater provides for a degree of protection from the contact with these pathogenic organisms or microorganisms, including those that cause cholera, polio, typhoid fever, hepatitis, amongst others. Yet disinfectants should not only kill your pathogenic microorganisms, but should have a residual effect, which means they remain active in the water after the disinfection process. And this really means here, so if you're disinfecting, that actual contact process with your UV light or your chlorine or whatever disinfectant is for some time. But then when this water actually goes into your pipelines or actually enters back to the environment, it should have some residual effect, and we'll sort of discuss the residual effect in the presentation. Your disinfection efficiency is usually measured by counting indicator organisms which coexist in large numbers where you have these pathogenic organisms or microorganisms. And in the case of drinking water, this is usually total coliforms. In wastewater, it is fecal coliform, and in some cases, we look at E. coli or total coliform. Your most common means of disinfection would be disinfection via chlorine, and this could be gaseous chlorine, chlorine dioxide, sodium hypochlorite. Also, very popular is UV radiation. There are other means of disinfection. They tend to be less popular, and these include ozonation, hydrogen peroxide, the use of chloroamines, potassium permanganate. You have other halogens that are used for disinfection. Your disinfection, the effectiveness or your ability to disinfect really is a function of your disinfectant's concentration and the contact time. Right. So if we were to just go through here, in the case, I would go through the chlorine process because this is the most common disinfection process for us. In the case of UV disinfection, so it is the water or your wastewater is exposed to UV light, and really when we say concentration and time, it's that intensity of UV light and then the time that you're in contact with this UV light. Great. In the case of chlorine, you'd normally add chlorine. So you have like a chlorine demand, and your chlorine demand is really the difference between the chlorine that you add to your water or your wastewater and the amount of residual chlorine remaining after that given contact time. And we discussed really that contact time is the time that you're actually dosing, or the time that you're there with that UV light, or your typically for chlorine it's like 30 minutes too. So after the 30 minutes of chlorination is where we really take our residual chlorine. Your chlorine demand would change with your flow rate of your water, the time, the pH, your temperature, your water quality. And when we say water quality here, we refer to the remaining impurities in your water, water or wastewater after treatment. Your total chlorine is the chlorine that remains after your chlorine demand is met. And really that is a combination of, well, it's a sum total of your combined chlorine and your free residual chlorine. Your free, it's the combined chlorine first, I guess. Your combined chlorine is that chlorine now that binds or bonds with whatever organic or inorganic nitrogen compounds you have remaining in your water after disinfection. These are usually very mild disinfectants. So a typical example would be like your chloroamines. They are mild disinfectants, however, they are not as effective as the major disinfectant. So a free residual chlorine here is the chlorine that remains and is available for disinfection. Your residual chlorine here is really what you it is going into your distribution system, or your what remains with your water that you're discharging back into the environment, right? So after we get through, and like we say, your residual chlorine here is a function of your impurities, your pH, your temperature, and you really see this in your ORP measurements on your plant. Right. The context now of where COVID-19 comes into your water and your wastewater treatment. Here, the World Health Organization in its interim guidance published on April 22, 2020, that the risk of transmission of COVID-19 virus from feces of an infected person appears to be low, there is evidence that infectious COVID-19 virus may be excreted in feces, and there are several studies have detected COVID-19 viral RNA fragments in the fecal matter of patients. The presence of COVID-19 virus in untreated drinking water is possible. It has not been detected in drinking water supplies thus far. So based on that, and then based on previous outbreaks of related coronaviruses, the World Health Organization and the CDC has said that the risk is expected to be low. And the previous outbreaks here that we talk about would have been the severe acute respiratory syndrome, which was SARS a couple of years ago. And there was a Middle East respiratory syndrome, which were all coronaviruses. Research is still ongoing to understand the characteristics of the COVID-19 virus. And these are things viability, survival time, migration patterns, transmission pathways, and activation by conventional disinfection practices. In the past, the conventional disinfection practices would have proven effective in eliminating or treating with corona-related viruses. So that is where it's important for us to have proper disinfection procedures and protocols while this research is still going on. So while the research is going on, IWA has done some research, and they were doing research on combined disinfection techniques. So what they have done, they would have increased their ozone and UV dosages to achieve a higher level of disinfection initially, and then they would have added chlorine, and the chlorine is just added for final disinfection and then to maintain a residual chlorine. Because if you add too much chlorine, or you end up with a very high residual, you could have ecological impacts in your receiving water. So you can't exactly just put a high amount of chlorine for the disinfection. So what from their studies, what they found was that the combined techniques basically in their studies, so the fecal coliform was eliminated down to less than 2 CFUs per liter, and their residual chlorine was less than 0.1 milligrams per liter. So the use of multiple disinfection techniques can provide wastewater treatment with greater reliability, robustness, and flexibility. At this time, the advice from the CDC and the World Health Organization states that the standard practices associated with wastewater treatment plant operations should be sufficient to protect wastewater workers, and include the administrative and engineering controls, hygiene precautions, specific safe work practices, and personal protective equipment. And I believe the webinar series will have a separate session to discuss the controls, the PPE, and the CDC and WHO at this time doesn't recommend any additional COVID-19 specific protections for workers involved in wastewater management. Because that there is a possibility for the risk, and we're not exactly sure, what that is. A couple points, control points were identified, and then the potential risk that these have, and then the possible risk responses. So for wastewater treatment, these are usually open basins, and the potential risk would be the aerosols that could be generated during the treatment process. And the response at this time would be to communicate these risks, provide signage on PPE, and ensure that the operators are educated and aware of the potential for transmission. And water disinfection, so you could have infectious coronaviruses persisting in domestic sewage. Again, at this point, it is not, but it is a possibility. And here the response measure would be to ensure you have optimal contact time for chemical disinfection. So this is where effective and efficient and proper disinfection.
So can I switch?
And in terms of drinking water treatment, again, you have infectious coronaviruses in water supplies impacted by wastewater in effluent. And this really is because